Hi, this is Dr. Dan Sullivan with the Sullivan Group, and this is a short demonstration of a new, first-of-its-kind program called ED Guidance, co-developed by Nuance and the Sullivan Group. ED Guidance lives inside of Nuance's Dragon Medical Advisor and evaluates your medical record real-time during the patient encounter, offering guidance focused on improving diagnostic certainty, reducing medical errors, and keeping our patients safe. ED Guidance works with all of the popular electronic health records. ED Guidance lives outside of and communicates with your electronic health record. You may place it in any location that's convenient for you. You can float it. I like to put it on my second monitor. Let's dock it right for this presentation. ED Note: I will use some macros and some dictation to move quickly through the chart. The patient is a 20-year-old male with a chief complaint of back pain, period. ED Guidance will now evaluate the medical record real time through a series of algorithms, provide a list of conditional clinical drivers that TSG has developed over the last 2 decades. Clinical alignment around the drivers is known to be associated with a reduction in medical errors and malpractice claims. After review of tens of thousands of ED claims, these are the critical elements that can lead to a correct diagnosis, but are often overlooked or missed, resulting in medical error and the failure to diagnose. Think of ED Guidance as a checklist. There's nothing required, no hard stops, just suggestions that could make a significant difference. This patient presents a good example, and it's an actual case. What's the error profile here? It is anchoring on musculoskeletal back pain and failing to consider more serious problems in the differential. So let's make our chart. Back pain history 1. Onset's gradual, that's typical. That will retire. There's no movement or migration, so that just retired. Let's give the patient something a little unusual. The pain is located in both the lumbar and thoracic areas, period, new paragraph. That's location, so that will retire. But the algorithm will now recognize the presence of 2 levels of pain and will suggest consideration of a spinal epidural process in the differential diagnosis. It will also add conditional guidance, risk factors for the possibility of spinal epidural abscess and bleed. Back pain history 3. Patient was lifting furniture, that will retire. There's no incontinence, that will retire. But the patient has had a fever with shaking, chills at night over the last 2 weeks. The program will recognize that and 2 levels of pain and will now suggest a consideration of the possibility of a spinal epidural abscess in the differential diagnosis. Now, the practitioner may not ever have seen one of these or might not have seen one for years, may be a practitioner in training. We believe that at times clinical evaluation support is critical. Not often, just sometimes, and when needed, it should be immediately available inside the user interface without ever having to leave here. You shouldn't have to pull a cell phone out of your pocket. You shouldn't have to leave and go to the internet. In this case, this is a spinal epidural abscess quick consult. Key history, key physical examination, clinical risk and safety pearls. Let's close that. Another important feature of the program is when the practitioner said, this is a 20-year-old, or typed, this is a 20-year-old male with a chief complaint of back pain, that went to the cloud, and it returned diagnostic drivers and resources. And so the practitioner just got 0.5 credits internet point of care CME. If you see this patient, a febrile child, an abdominal pain, a chest pain, a practitioner may have 3, 4, or 5 CME from a shift, which can be retrieved at some later time. Another important part of the program is assisting with recall. Lists of risk factors is a great example, very difficult to remember. And so here, back examination, just do a back exam. But here we actually list the risk factors to assist with recall. There's no prior epidural bleed, comma, patient's not on anticoagulants, comma, there's no bleeding disorder, no recent spinal procedures, period. There are no spinal epidural abscess risk factors, period. So you can name them individually, or you can say positive or negative or unknown, and it will retire. Back pain review of systems, back pain physical exam, The program will recognize vitals reviewed and retire it. There is in fact a fever looked at the track board. Back examination is normal. There's no spinal or paravertebral tenderness, period. And before we get to the neurologic examination, consider this is a back pain case. It may in fact be a neuro case, and there may in fact be a spinal injury. Correlating the physical manifestations with the level of injury can be difficult. So again, sometimes clinical evaluation support can be critical. Here, remembering what level of sensory is correlated with what part of the body. Maybe the practitioner wants to use a dermatome map or wants to look at a table of motor to correlate some level of motor with a part of the spine. Also, there are additional resources that are not in the drivers, case-specific resources, never encyclopedic, just what you need to know for a back pain case. Here, don't remember the spinal cord syndromes. There is one. I think it's anterior. What does an anterior cord syndrome look like? There. All right, on to the neurologic examination. Now, we have tens of thousands of neuro cases in our database, and 5% don't have any neurologic examination. 10% say something like neurologic examination is normal, period, neurologic examination is benign, period. But we believe in a case like this that might be a neuro case, you need a complete examination of the relevant organ system, and because we're working with a Nuance platform, that won't retire it, but this will. On neurologic examination, there's no sensory or motor focal deficits, comma, deep tendon reflexes are normal, comma, straight leg raise is negative, period. And that will retire the diagnostic drivers. That's ED guidance. And thank you for taking the time to watch this video. ED guidance used by your group, hospital, or organization will result in clinical alignment around these key clinical drivers, will improve diagnostic certainty, reduce medical errors, and reduce exposure to medical malpractice claims. Thank you.